Whenever you're ready.
How are you guys?
Oh, good.
Good. Well, we're excited that you have joined our panel session this afternoon. It's going to be on lessons learned from and next steps for implementation following a needs assessment that we did on water quality in rural Uganda. The project started this last summer. So my name is Cassity Gutierrez. I am a faculty member in the College of Pharmacy and Health Sciences here at Drake.
And I'm Hayley, LeBlanc, and I'm a senior neuroscience and psychology double major.
I'm Lindmark. I'm a senior environmental science major with a global public health concentration.
So the first thing that we thought we'd kind of walk you through is the country itself and where it is.
So this is Uganda. The population is about 38 million, and it is about the size of Oregon in terms of geography.
And so this is kind of a brief history in the beginning of what the water issues that surrounded both Uganda and Africa in general. And so one of the first things is, this is a map from the 1930s, so it's kind of hard to see on here, but Uganda was originally under British control, and when they moved into the city, they divided the main city of Kampala, which is known for the 7 hills or 7 districts that surround it, and they divided it basically in half and gave half to the King of Uganda, which is the region where Kampala is located in, the kingdom, and then the other half went to the British government. And so the slang term for the division line was the septic fringe, and that was in reference to the British side having water resources, including sewage and just pumping water in, and they paid for that through their taxes and different fees, whereas the King of Uganda side did not collectively come together to pay fees, so they lacked those basic necessities. And from those post-colonial times, you start to see some of the patterns that emerge in terms of water sanitation and health hygiene in Uganda. And so these are the districts that I was mentioning. So this is the main city center, and this is where the King of Uganda's palace is. So this is kind of the divide, so to speak. And then this is where the British controlled area was. And then these are in reference, these major roads spike out from the 7 main hills. And so in the previous map, this is Lake Victoria, which is the main lake found near Uganda, and so Kampala is just right up there in relation to Lake Victoria. And so when the British were pumping in water, they were taking from resources like Lake Victoria to pump it in. And so this is kind of, they've been addressing issues specifically in Uganda with regards to water sanitation and health, because they've noticed that there's been an increase of bacterial illnesses and a decrease in sewage capabilities. So with regards to other developing nations within sub-Saharan Africa, which is that belt of Africa that encompasses all the nations there that are still developing, they noticed that Uganda in particular lacks the infrastructure to support water and water capabilities, and that kind of stems from the area never really developing and the British side only developing and none of the outlying hills developing. And so one resource found that even if they piped water through the city, throughout Kampala city center, that it wouldn't be affordable for the lower income citizens of the community, and that it would be not sustainable due to the fact that they wouldn't be able to maintain the upkeep once the water pipes were there. So that's also led to a lot of problems in terms of privatization of the water system in Uganda. They've had to kind of compromise on costs, and so that's why they haven't really pushed to develop water yet. They haven't deemed it a necessity because people think, oh, I can just get water from rain, or I can just get it from the ground, but that's not necessarily the cleanest practice. And so 55% of rural Uganda has access to safe water, but that doesn't necessarily mean it's piped water by any means. It could just mean that their source from the stream has been tested and it's clean, as composed to also just looking at Kampala, 67% use the public water system. So as you can still see, these numbers indicate that only about half of their population even have access to this clean water, and specifically even in the city center, they don't really use piped water even there. And so some of the problems rural communities in particular face are definitely going to seek the water, and so having to carry it long distances, and if you're going to school, you have to get up early, go get your water, bring it back, and then you have to make sure in terms of increasing agricultural production in Uganda that none of the runoff from those pesticides get into your water, and so there's a lot more rural problems that can arise just due to agriculture, distance, and the differing areas that the communities are in, and that they may be closer to a borehole, which is a water source found directly beneath the surface of the earth, whereas someone in another rural community might not have access to a borehole and will have to seek other measures.
And like Heather was saying, it goes beyond just access into problems of even if they have access, is the water clean, and even knowledge gaps of knowing whether it's clean.
And so, particularly in terms of water sustainability, when Uganda chose to put water as an issue that wasn't going to be focused by the government, they had a lot of corruption in the government that forced water prices to spike, and so a lot of businesses and different groups will either drill for their own borehole water and then not put it under government regulations, so kind of go outside law to get their water. And so obviously there's flaws in that system because you don't know how safe that borehole water is, and there's regulations for a reason, but also they are able to spike the prices in the private industry because the government has let them have exclusive control.
And even if there is piped water, there's no guarantee that if you turn your faucet on, water will come out. The government can shut off water if need be, and as we'll get into later, it may not even be clean water, even though it's government piped.
And so some of the water research thus far in Uganda, well, one of the main surveys, this survey looked at different countries, not only in Africa, but also in South America, and they found that when you conduct a survey at a household level, you're able to account for more variability, which makes sense because you don't know if there's a rocky terrain they have to go through to reach a water location, as opposed to just a general census, which kind of groups all rural areas together, because as we know, there's a lot of differing variables with each rural community and the environment they have that determines their access to water and their knowledge about water. And then two very recent studies from this year found that the perceptions of clean water were skewed. And so what they did is they surveyed people in Uganda, specifically in the rural communities, and asked them, do you think tap water is safe? And then tested it. And then do you think rainwater is safe? And then tested that water. And they found that when most people said they thought tap water was unsafe, and it was actually safe. And then they thought that the rainwater was safe, inherently safe, but when they tested it, it was not safe. And so the perception that this new piped water isn't cleanly because it's so new, that they don't understand that that could be cleaner than a rainwater source, because rainwater can be contaminated in so many different ways. And then the second study, they this year actually trained students in rural communities, as they noticed a lack of education between the medical health of students going to university level. So these are students about to enter college, and so basically they've set up training sites in between the city and the rural villages where they could learn safe medical practices and also learn about hygiene and sanitation. And then these students brought it back to their own communities and taught the members there. And they found that it was very successful, and they recommend specifically in Uganda and these rural areas with regards to water, sanitation, that all research should be conducted in a community-based education way because it empowers the community to take responsibility. And if you teach it to someone else first and then they teach it to members of their own community, they're more likely to be able to explain it in a way that makes sense to a new person. And so now we're kind of getting into what our research specifically has looked at.
So to kind of dive into a kind of overarching term, both of our experience in Uganda and our research, what is sustainability? So sustainability and sustainable development really is what we're looking at, encompasses the overlap between several aspects of life in general. You have social, economic, and environmental. So any development, for development to be sustainable, it needs to meet all three of those needs, meaning that you can't have people's social standards diminished because of something you're doing for the environment. And the reverse of that is true as well. You can't have people benefiting economically from something and having it hurt the environment in terms of sustainable development. So to get into why that's important, Hayley and I, to give you a little background about how we got involved with Uganda and how we ended up in Uganda. Drake has a program that goes to Uganda every summer. It's a May travel seminar, and we went in the summer of 2014. And while we were there, we visited several places, such as primary schools, health centers, a health center that Drake actually started, which has been pretty instrumental in our research. So this is the health center in Shikamba, which is the village we did our research in, and we'll get more into that later. But the health center was started in partnership with Drake students, and a Drake faculty member, Dr. Senteza, who's on our research team, is actually from this village, and his family still lives there. So that community and our partnership there has been extremely instrumental in our research.
Yeah. And there's definitely been a lot of issues, if you've heard talk of voluntourism and the complications there of a group going in and just helping and dumping what they believe are their ideals onto a community. And we believe this is different in the sense that Dr. Senteza is actually from the community, and so when we work in the community, we first talk to village elders, and then from there we proceed, and so it's very community driven.
And the health center is now completely independently Ugandan staff it, and no outside funding enters the picture at this point, so that's been key as well. So following our initial trip to Uganda, as I said, we visited all these places, and one thing that kept coming up was the issue of waterborne illness, as we mentioned, obviously a big problem. So we both returned via some assistance from Drake to do some initial water testing at both the primary school and the health center. So we did that water testing, but we ended up with more questions really than we had answers to those questions after that initial round.
And this is the borehole that's specifically in the village, and so that's right in front of the health center. And in this village, there's two main boreholes they use, and so this is the one that's closest to the central part of the village, and then there's one on the outlying edges. They also have access to streams that are farther away.
So when we tested that water, it came back clean. But despite this, the health center was still reporting repeated issues with waterborne illness. So we wanted to identify why that was.
Can I intervene with the question real quick?
Yes.
Are the boreholes on public or private property, and are villagers charged to access the water from those?
So it kind of depends on each borehole, but most of the boreholes were originally implemented by the Ugandan government as a means to kind of disseminate water, and so, but then they left it up to the community to fund. And so in this case, a community will often fundraise together and have a borehole put in, and then they all use it as much as they want, and then when it breaks down, they all collectively come together and pay for it to be fixed. And so if it breaks and no one comes together to pay for it to be fixed, then it will just sit there for a while until they have enough money. And one of the big things they do that's kind of unique to these types of communities is that they specifically at the primary schools teach them how to pump the water correctly and not use the handle too harshly, and that way they're able to kind of avoid these problems associated with rough usage on the borehole pump. And one of the problems in the village is that they don't actually have this mandatory someone standing there saying like, don't pump it too hard. And so a lot of the times it will break because there's inconsistent pump styles. And so if one person pumps vigorously and one person comes and pumps slowly, it can mess up the actual engineering within the system that's bringing up the water. And so this borehole itself is on community property because it's located right in front of the church and the health center. And so it's not designated as only the health centers or only, you know, the churches. It's for the whole community to come and use, with the knowledge that if they use that source of water, then they will be expected to pay in if it breaks.
And one of the things that happens when it breaks, which leads us into our next point, is that people will use these natural sources, so these natural springs that pop up throughout the landscape, and they will go and fill up water there. So that was one of our questions, was why are people still getting sick if this main source of water is, in theory, clean? So one of the possible reasons is those natural sources of water may be contaminated and people may be using those instead of the borehole. It's also possible that it stems from a hygiene issue, so whether that's washing your hands after using the restroom and then contaminating your personal storage of water. And then finally, most of the transportation of water happens in what are called jerry cans. So those are those canisters there, previously usually used for gasoline or something like that, and people carry water around in those, but is it possible that maybe they're not switching out containers between use at natural sources and boreholes, or maybe are they washing it out in between use? So we had all of these questions, and when we arrived back on campus last fall, the Nelson Institute here at Drake had just announced a call for proposals for a Global Pressing Issues grant, which happened to encompass the idea of a grant hoping to deal with issues such as water and health, which conveniently we felt very close to in terms of that. So we applied for that last fall and got funding, which is kind of what's led us to this ongoing project.
So our current research focuses around kind of what we've been hinting at, that you empower the community and gain their support to implement solutions to a problem you've identified. And so you may be thinking, what is this community-based participatory research? And Dr. Gutierrez probably can explain it a little better.
Yeah, so thank you guys for all that background information. I learned a lot that I maybe should have known before I went to Uganda. My background is in public health. Before I went into academia, I spent 10 years in public health. And when you are trying to go in and work with a community, you need to have their buy-in, but you also need to develop capacity, because we can go in, we know with public health programming throughout the United States even, that we can go in and implement a program, but once we pull out, how successful is that program going to be? One, if there's no buy-in from the community members, but two, if there's no way to sustain it, then you're basically dropping something that's going to be a temporary fix. So when we proposed our study, we wanted to have the foundation be a community-based participatory research approach. Very similar to what they did with the health center, in that they got the buy-in, they assisted, but then they had a way of developing capacity and empowering the community members to sustain the project. So that's kind of the baseline of it. We are going to, every stage of this process is informed by members of the community. So to include, even when we were writing the grant, they were in communication with members of the community during the needs assessment process. So you don't just want to go in and say, this is what you need. You want to, we could do research, so we kind of know what the needs are, but do we really know what the needs are in that specific rural village? And we need to hear it from them, because if we say this is your need, but it's not truly what they perceive as a need, there's not going to be any change, or at least not any sustainable change. So even in the needs assessment process, we worked with individuals in the community to go out and do both kind of the water testing and the qualitative needs assessment, getting some information from the households on what they perceived as the water issues, which we'll look at here in a second. But we also developed capacity. We trained them on how to do even the needs assessment process. And so this will carry through the entire project. They will help. When we go, we will have implementation strategies, but they will be informed by the community members, and the individuals actually carrying out the implementation will be community members that are trained. When we go in there and train. And then even the evaluation process at the end will be done in conjunction with community members. Any questions about something? How many of you have seen studies of CBPR? Community-based participatory research?
It's kind of the new frontier of health science research, especially, or it's not new, but a lot of people don't think about it, and when they think of the problems associated with volunteerism and just going in and dumping a solution, so buying filtered water bottles and just leaving them, but with no way for the community members to replenish those filters, then it's basically a useless system that they won't be able to in turn cater to their needs.
Which links back to the importance of sustainability, like we were mentioning earlier. Yeah, do you have a question?
Yes, I do. What is the sewage? How is this being maintained in the village?
So right now, the sewage system in the city center itself is kind of similar to the statistics I was showing earlier for the amount of people who have piped water. And so if you equate it to that, so it's about half of the people have access to actual sewage system. Otherwise, what you're looking at is in an urban environment, you'll put it into a container and then just kind of dump it out in the yard. And then in the rural community, they also have
Pit latrines, where you dig a hole to a certain depth, ideally not to the water table, but certainly that could lead to more contamination, as we'll see. They dig a pit and then you just set up a little outhouse structure around it. So that's very common in the rural community. So there isn't really any structured, like, national sewage system.
Well, so is that affecting the water?
It's definitely, yeah, it's the most likely affecting the water.
And one of the issues that we were looking at last summer was that they were thinking about potentially expanding the sewage system that was in the city further outside the city limits, so to the more of the suburb type areas. And one of the issues that we foresaw was that the runoff and the pipe system there could potentially start leaking into the previously clean water systems. So when Uganda starts to develop more infrastructure with regards to piping water and sewage, they'll have to consider both together, because that's definitely an issue that has been studied in the past with regards to sanitation. And even in articles I was reading about surveys being done in the 1930s, they were saying that the issues of sanitation in terms of sewage were causing a lot of the illnesses that people were experiencing, such as diarrhea and other illnesses such as that. And so another component of the Nelson grant is to also educate our campus about water issues, because a lot of people take water for granted and assume, even if maybe they don't have piped water, that rainwater is a suitable substitute. And so one of the issues that we identified as addressing to the Drake community is that the Iowa water quality is actually not as great as it could be. And I mean,
yeah, like, I don't know if you guys saw one of the concurrent panels is on Iowa water quality going on right now. So there's a large problem with agricultural runoff here in Iowa, and the fact that Des Moines Water Works to filter your water is having to use so much more filtration and spend so much more money to actually get to a point where we have clean water. So I think so many of us, turn on the tap, drink water, don't think of it, but really in reality, like, we have ongoing issues just as most of the world does. So I think for us to put it into context in that way, it's important for people to understand that this is not an isolated, Uganda is not alone in this. It may be different problems, but water quality issues are global.
and even water quality on campus varies between sinks. And so first year biology classes will often do microbiology classes will do tests of water just to kind of introduce them to the scientific process, but also to examine water quality. And they have noticed differences in the sources just from different sinks from different areas, and that also can contribute to some problems we experience on campus.
So getting a little bit into our results this summer, one of the things that we did while we were there was the actual water test. So we used what are called col plates, which test for coliform bacteria and E. coli, which are good measures for fecal contamination, which is what leads to a lot of waterborne illnesses. So this is a picture of a coliform plate test. So there's 96 little circles, it's about this big. And you fill up each little well with water from the source, and then you let it sit for 48 hours, and you count how many wells turn a certain color. So this well, it's not easy to see in this light, but some of these wells turned blue and some of them didn't. And then the next one actually, so that one has no blue wells, so you can kind of see in comparison. The last one had some blue and some not, and then finally, the final one has all of those wells are blue, which looks very dark in that light, but so that shows extreme contamination. So you count the wells, and they come with a little chart that indicates how much bacteria is present, and then you use a fluorescent UV light to see the fluorescence, which indicates E. coli bacteria, which is even worse than just general coliform bacteria. So,
And just to highlight like what is a good amount of wells that should even be fluorescing.
it should be none. The American standard is 0 wells for drinking water, and for like recreational water, like a lake, you could have 1 well that fluoresces, and even then, people don't particularly care for fecal contamination in lakes. That's just what is absolutely allowed as a maximum. So this next graph shows us all of the water sources that we tested while we were there. So we tested 3 different types of sources of water. We tested boreholes, which are shown in green here at the beginning. We tested households, which are shown in blue, and we tested natural springs, which are shown in red. And the light bars represent coliform bacteria, while the dark bars represent E. coli. So you can see some general trends. The boreholes were generally much cleaner than anything else, which means that in general we hope groundwater isn't contaminated, which is generally a good sign. You don't want groundwater to be contaminated because that means you do not have a clean source of water. The households showed pretty significant variability. You can see this household number 1 was our most contaminated source of water that we tested at all. And that had maximum that was that picture I showed you where all of the little tiny wells turned blue. So that's extremely contaminated. Whereas some of the households had pretty minimal contamination, comparatively at least. Likewise, the natural springs showed varying degrees of contamination as well. So what this may indicate is that different habits in terms of water collection and transportation lead to different levels of household contamination, as well as natural springs may be affected by runoff, like we said, or sewage and that kind of thing. Yes?
So household says piped water?
No, it's not piped water. So that would be water that they would have brought back to their house and either put in a storage container or just had coming out of a transportation container. Some households have like a rain catchment system, so they'll have a water tank set up out back usually.
These are all in the rural communities.
Yes, yes. So
they don't have the access to piped water yet in this community. So,
And one of the reasons we did the households also, we didn't have enough plates to do all the households, but we were concerned with end products. So just like these ladies discovered before, sometimes it's relatively clean at the source, but by the time it goes through the contaminated jerry cans, it could be very contaminated at the site. So
I was just going to point out the 2 that had no contamination, the health center borehole here, which we showed earlier, and then the health center actually does have a water tank set up next to the health center that pipes water into the health center, so they're the only place that has piped water, and it's privately put in by themselves. And they have filtration systems set up, and that water also came back clean. But other than that, all sources we tested had some level of at least coliform bacteria, if not also E. coli.
now, one of the families, just kind of anecdotal, but one of the families that had probably the most contaminated was getting it from a very clean source, right?
Yes.
They were getting it from the health center, so it just kind of shows, again, that demonstrated how contaminated the transport and storage were.
and just like going off of that, like if they don't understand that the container themselves can be the contamination source, that's a lack of knowledge that just because it's coming from the cleanest, clearest source, it can still be stored improperly or used improperly.
Yeah. So that's an example of actually an in-ground storage well. So they have a rain catchment system that pipes into a well beneath the ground, which you would think rainwater, like Heather was saying earlier, research, generally people would think that rainwater was clean, and this one was also contaminated, so it's not always a good indication.
So one part of this process is is we did the water testing, but we also wanted to hear from the community members. And so we created this questionnaire kind of with overarching themes. If you can see on the far left side of your topic, water sources and acquisition, water transport, water utilization, water quality, waterborne illnesses, and then ideas for water improvement. And then we had some kind of leading questions. So when we went in, our intent, knowing that most people didn't speak English, was that we thought we would be able to conduct a lot of these. But what we learned, and that's part of this process, is learning, is that it was difficult for them to, one, feel comfortable communicating with us or finding people willing to talk with us, but two, there still was, even though there might not be an English language barrier, there were still barriers in understanding. So our best strategy was using one of the clinicians, I think she was one of the lab techs at the health center that knew the community well, was trusted, and kind of understood why were we coming asking these questions, because otherwise people were a little standoffish, and we probably weren't getting honest answers. There's some self-report bias there. So the second column just has some of the questions, and I'm just going to briefly go over some of the compiled answers. What's interesting, in our whole time there, we got about 10 total surveys done. We had thought we'd get many done, but it took a long time because you were navigating to get out to those areas and then to talk with the family. They wanted to walk you to their source, so it could almost take a couple of hours working with one individual or one family to do this survey. But what's interesting is we got a lot of the same responses from people across the board, so I'm just going to talk briefly about that. Water sources, as we discovered, again, were a lot of the boreholes were the primary source, and then some had catchment tanks, but not a lot. I know we didn't see the entire community, but not a lot. And then there were different spring sources. A lot of times, as I mentioned before, the spring was the secondary source if something would happen to the borehole. And a lot of it came down to convenience, what was going to be closest so that they weren't going to have to walk so far with their jerry cans. We asked about storage and transport. Everything was done in the jerry can for transport, or those who answered. And then the jerry cans were actually used for storage unless they had a tank. They use these for all sources: drinking, cooking, cleaning, bathing. And we asked about safe practices, and I really never heard, maybe one person said they boiled for every reason, but most people said they boiled to drink. So they weren't boiling for any of the other reasons, and some people did not even boil to drink. So water quality, that was an interesting question. We asked them to assess the water quality of where they were getting, what their perception was this clean water? Because we might show it's not clean water, and we didn't know at that point because we hadn't finished the testing, but they might think it's very clean water. So we thought that was interesting. We quickly understood that we needed to have some type of scale for them. So we said 1 to 5, with 5 being very clean water and 1 being not clean at all. And so as you can see here, surprisingly, a lot of people thought the water was relatively clean, some rating up to a 5, or many. I didn't write down every group because the average was around 3 or 4. So they had a lot of confidence in the cleanliness of their water, unless you, is that what you observed in those conversations too? And then we asked them, had the water quality actually changed? And many felt that it had maintained its stability. Some felt that it had gotten better or improved over time. And one of it was because of an initiative called ATC, which wasn't a government initiative that was going on in that community at that time. Do you remember what that stood for? I had ATC written in my notes.
Like appropriate technology, maybe commission, something along those lines.
Do you remember doing?
Not quite.
But there were some other projects going on there at times that a few households were aware of, and they felt that that had improved the water quality. So that was interesting for us to see that although we saw that there was contamination, many people felt that the water quality was relatively good. This was also interesting for me. This, as a researcher, I always think, again, that self-report bias might come into play where you don't feel comfortable sharing, and even when it went through IRB here, they said this might be a sensitive question, and I think it proved to be one. we asked about waterborne illnesses, and certainly we knew anecdotally from the health center records that they have a lot of waterborne illnesses that they might see people for. Yet when we asked people, most said that they've had nothing in the last 12 months, and their family members have not had anything, diarrhea or typhoid or anything related to waterborne conditions. So we saw that disconnect, and knowing that this exists, that people didn't indicate that that was happening in their household. And again, when you're reporting on a disease, there might be stigma associated with that too. So I don't know for sure, and I'm thinking that might be the case, but again, that was what they reported back. And then we asked finally, again, in that quest to know what should we do when we're going in and doing implementation, we asked what would you think, or what do you think is needed to improve the water quality in this community? And everybody talked about the need for education. Many talked about a knowledge gap between the elders or the older individuals and the children, that the children that understand safe handling practices and water quality issues, so maybe implementing education specifically with that generation. Of course, the need for more boreholes, the need for easier transportation, the need for storage tanks, needing education again on how to clean the water and boiling the water, so handling practices, and a need to test the water quality to make people understand really what is the water quality, and then making sure to communicate that so people understand what their water quality is. So that was our needs assessment. We did leave some of the forms with the Sandra at the health center, and so she has been collecting some additional, as people have come into the health center, she's been able to collect some of these or do some of these interviews, and we're eager to get some of those back.
So kind of bringing it all together, what does that all mean, all of those results? Obviously this is very preliminary from our needs assessment. Further research will continue to be done by us, but obviously there are differences in water quality between sources and between households, which leads us to the fact that different people and different behavior are leading to these issues. However, we know community intervention has been successful in the past, both from past research and what we've witnessed with the health center ongoing in this village. So we know that going forward, whatever educational intervention we implement needs to be community supported, because we know that's ultimately what works for this community and what will be sustainable for the future. So some of our next steps, one of the things that we're going to be doing before we even return is we mapped out all of the locations. They're hard to see, but the little red dots, there we go, are all the different places we sampled around the village. So A, B, here are where the health center actually was located, households across the street, there were several households back here. Anything further off the road was a natural spring of some kind. And then further up into a different kind of community, we had several other boreholes, as well as more natural springs further up. So what we're going to be looking at is doing some geographic analysis to determine elevation in these areas. Could it be possible that we're looking at water runoff going down and actually contaminating various places? But also, are there lots of pit latrines located near each of these places? Just various things to kind of analyze what kind of correlations and patterns we might see in the actual sources sampled. Beyond that will be our return trip in January. So between now and then, we're going to keep looking at all this data and kind of determining what our next steps are. What are we going to report back at the health center, and then work with them to develop some sort of intervention. Because again, we want that to be community-based. We want them to really put forth the idea and have that investment. So before we return, we want to have kind of a general outline that they can kind of flesh out.
Especially since there's so much research occurring within sub-Saharan Africa specifically with water, and just from those two studies from this year that examined water quality, we know that it will be important to do a full literature review to assess what has been successful in the past and what really hasn't. And also this year, the Gates Foundation made their initiative water and water sanitation and health. So obviously it's an issue that relates to the whole world and is being addressed on a global scale.
And we also want to conduct more water tests. One of the things we found was, like Dr. Gutierrez was saying, is that the people we were testing their water were really interested in the results from that. So next time around, we want to do that again, so we can, and like actually show them that process, so they can learn from that as well to continue that community interaction. So some of the challenges and learning experiences, we've kind of mentioned it throughout, but some of those cultural barriers that Dr. Gutierrez was mentioning, certainly we found that villagers were much more apt to talk to us when we had someone doing translation and weren't just having that interview in English, as well as they found it more comfortable when we had someone from the health center with us to report back. So that was an interesting thing we found. With the water tests, we found that people wanted to take us and show us their cleanest water, maybe like the water that they boiled or something like that, but we really wanted to sample just straight before it was like anywhere it could have been contaminated, so we had to kind of fight through that. And like I was saying with interviews and communication, it just all came back to those kind of cultural barriers and just kind of adapting on our feet. Like we had to really learn as we went on how to conduct the best interview, I think. So that's the end of our formal presentation. I just want to open the floor to any questions anyone has.
Has anybody even been to Uganda in the audience? Side stream.
I'll ask, what did you drink while you were there then?
So we bought bottled water usually so we leave like our hotel or hostel each morning and take bottled water with us, and that's the same thing the trip does. I sampled water straight out of one of the filters at the health center. Me and Jimmy both decided to give that a try, and we were fine, and that water came back clean, so that was good.
Before you tested it, huh?
Yes.
Brave, brave woman.
Usually when we stay at the hostels, we also use bottled water for our toothbrushes, just because that's also piped water. But Megan and I, last summer, decided not to do that, and that
Tempted
wasn't,
fate a little bit.
that wasn't a good idea. So
for us.
I would recommend water.
Yes, we definitely recommend there is something to be said about even like a little bit of water, obviously.
And it's also just being from a different area. If you're not used to that type of water, even my mom gets sick when she goes down to visit my family in Louisiana, just because there's a difference in water quality, even in the United States.
Yeah, I saw that in the background you showed there. The water quality at the health center is far much cleaner, it's clean.
Yes.
We make use the health center to educate the community in the village on how to keep the water clean. I know this also might be a problem with the community with the financial status, but what do they do at the health center to make their water clean? If we buy those practices and take them to the community, educate them on how to do it.
Right. So yeah, the borehole at the health center, which was this one right here, came back clean. So that's where it is where a lot of community members get their water, which again shows that there must be some sort of contamination happening in the transportation. But the health center filtered water, so they run their water, they pipe it into a large holding tank that then comes down into pipes across the building, and they have filters. So those filters would be one option that the health center could help disseminate, but obviously we want a more sustainable solution than just giving out filters. So yeah, we definitely want to hinge our educational intervention on the health center, showing people like, this is what we're doing, our water is clean. I think those water tests and showing people how those work will be a key way to do that, because that's a very like visual, like you can see those blue wells are very like striking compared to the ones that are like clean looking. And the people we did discuss those with were very shocked to see that some of that water was that contaminated. So I think that, yeah, like you're saying, the health center will be hugely instrumental.
We, in the past, just to show how the health center has been useful in kind of disseminating the knowledge and explaining it in a way that makes sense to community members. In the community, there's a family with 2 children who have albinism, and so our class has donated in the past sunscreen so that it protects their skin, obviously for health reasons. And when we originally gave it to them on our first trip, someone from our group explained that they should regularly apply, but they thought that you had to apply from each source we were giving them, so they would spray themselves from 3 different bottles every time they applied, and so they were running out really quickly. And so the second time that when we brought more sunscreen, we actually gave it to the health center, and so the health center first just applied it for the children. They would walk over there because it was right next to their school, but then later they actually were able to explain it to the mother better on what they actually meant and what the guidelines were for applying the sunscreen. And so it's just using the health center as an aid to act as a way of communicating something that we might not, think of, because obviously if it's 3 different bottles of sunscreen, someone who regularly doesn't use sunscreen wouldn't understand that those are the same product, just look different.
It's coming back to those cultural barriers.
Cassity, you mentioned about the waterborne diseases that no answer whether they were sick or not, didn't have typhoid or not. The problem is that typhoid and malaria have the same symptoms. So many people in these particular areas get sick of typhoid, waterborne disease, but the thing is malaria. And that can take a long before they realize, oh, we are sick of waterborne disease from typhoid. Maybe the answer that you're getting from them, oh, we're not sick. But a certain period, but actually many people are sick of that and breaking down a lot.
Yeah. I think that is a very valid point. I mean, like I said, overwhelmingly, nobody really, maybe one household admitted to having any episodes of anything related to a waterborne condition in the last year. So
And I know Uganda in particular has had a countrywide movement to prevent malaria, and so that leads me to believe that they actually did see a decrease in the number of malaria cases, and so that kind of supports the idea that maybe they're thinking it's malaria, but they have kind of successfully eradicated it as a health problem in Uganda, and so it may be typhoid showing up and they just think it's malaria.
Do you have any data, for example, what the health center is using when they diagnose something that was caused by a waterborne? When they diagnose a waterborne illness, that there's education as part of that process. So has that occurred, or do you have any data around that?
Not have any data surrounding that, and I'm not quite sure what the procedure is after one leaves the health center with regards to follow-ups if they suspect it's a waterborne illness. And it may be that they see so many cases, there's not really a procedure to say, oh, change this practice, because if everyone's using the same source and it's right in front of the health center, you can't tell them to stop going to that borehole. And so that's kind of, we're seeing that gap of the borehole water we tested was clean, so there's obviously something else at play, and it's probably these jerry cans, or when they take it back, letting it sit for too long, or different factors like that.
I think that's a valid potential option for like future research and when we're actually.
or our implementation.
Yeah,
Yeah, I think that's a great idea. Maybe that is a big part of the education, is just training the health center employees when they have the contacts with the individuals who you would suspect have a waterborne illness, that they do more thorough questioning and then follow up with some health education.
Yeah, at this point, they see themselves as simply providing treatment and nothing more. So they just simply prescribing and and just saying this is what you need to take and go home. I don't think they're very familiar with doing the extra part of saying, if you avoid this or if you change your practices here or there, that you might be able to avoid this. And I think the educational part is really what is important, because as they live, anecdotally, they know that there's a lot of these problems. Typhoid is a big thing, and they know that waterborne illnesses are fairly dominant, but they haven't taken that extra step because they just function. There's so many people coming through, and there's few people under them. But I think it helps to say you can find extra role. Occasionally, there's been some people going there to do workshops on different types of healthcare behavior, and something with behavior is really hard. It's hard to change those, especially when there's a price involved. And the options beyond the needs for them to actually afford them. So that's another constraint. That's where we have to really think about solutions that are very, very sustainable. The filter is not new in Uganda, but the only reason that many homes don't have that is maybe not affordable. So you just don't need a filter, you need the container in which you're gonna have the water, disposed water, by the way, you need the piping and stuff like that. By the time you get through that, somebody's thinking about going to school, healthcare costs and other things and food, and that really goes down the road. So what is sustainable? Maybe education is one way to stop that and boiling water and stuff like that.
And when Megan and I went last summer, we did actually test at another, not a school from this community, but a school located around Kampala that actually has a pretty complex water filtration system. And so they use a pump system to both pump it up, filter it, and then they put it into these tanks that have individual chlorine-esque filters. And that was actually one of the most contaminated samples we tested. And so even in the case of a filter, there's still the issue that sometimes the filter doesn't get changed enough, or even the spout where it's coming out hasn't been sanitized. And so even if you have all the systems in place, if you don't have the education, you won't be able to provide the clean water that everyone is seeking.
Thank you guys for attending. It's a lovely country, so you should think about visiting.